What if the difference between life and death came down to a 5-day wait? Today, we're going to dive into the story of a medical breakthrough that's shrinking that wait, and, in the process, changing the course of a really deadly, deceptive disease.
It sounds almost too simple to be true, right? How can a simple scrape on the skin actually save a child's life? Well, the answer lies in a clever new test and the dangerous infection it's designed to unmask in minutes, not days.
To really get why this new test is such a big deal, we first have to understand the problem it's solving. And that problem is a deceptive disease known as the Great Mimicker. This is melioidosis. It's caused by this nasty little bacterium that lives in the soil and water in tropical parts of the world. For a lot of people, it's a hidden threat, literally lurking right under their feet.
And this is where it gets really tricky. Its symptoms can look like just about anything, from a simple skin infection to something as serious as pneumonia. This makes it incredibly difficult for doctors to diagnose correctly just by looking at a patient.
And getting that diagnosis right and getting it fast is absolutely critical. As the research puts it, any delay can compromise patient outcomes. What that really means is that the standard antibiotics you'd use for a typical infection are completely useless against this bug. The clock is ticking from the moment a patient walks in the door.
So how did doctors even diagnose this thing before? Well, that brings us to the old way, which involved a long, and I mean agonizing, wait.
For years, the gold standard was a culture test. A doctor takes a sample from, say, a skin lesion, sends it off to a lab, and then they wait. They literally have to wait for the bacteria to grow in a petri dish. It's a slow, multi-step process before they can even begin to figure out what it is.
And how long does this take? At a bare minimum, 48 hours, but as you're about to see, it's often much, much longer. All this time, a patient, who's often a child, might be on the completely wrong medication, or maybe no effective medication at all.
And this right here is why that wait is so incredibly dangerous. A skin infection is just what you can see. It's the tip of the iceberg. The real danger with melioidosis is the part you can't see, when the infection spreads inside the body, causing hidden abscesses in organs like the liver or spleen. Without a fast diagnosis, doctors don't even know they need to start looking for this hidden killer.
So, against this pretty bleak backdrop of a long and dangerous wait, a potential solution finally emerges. And this brings us to the hero of our story, a new test that offers some real hope.
It's called the Active Melioidosis Detect Plus Rapid Diagnostic Test, or AMDRDT for short. Just think of it like a pregnancy test, but for a deadly bacterium. It's a simple, point-of-care tool that was designed for one thing: speed.
And just look at this direct comparison. Look at the time to result. The old way, 48 hours minimum. The new rapid test, about 60 minutes. That is a total and complete game changer. So, a faster test sounds amazing in theory, right? But what actually happens when you put it to work in a real-world hospital with real patients? Let's take a look at the study that did just that.
Researchers in Cambodia conducted this study at a children's hospital. They were clever about it. They looked at a group of patients treated before the new test was available and compared them to a group treated after it was introduced, a classic and really effective before and after scenario.
Okay, so let's ask the key question. In that before group, the one using the old culture method, how long did those sick children actually have to wait to get the medicine that would work?
Get ready for this. The median wait time was 118.4 hours. Just let that sink in for a minute. That is nearly 5 full days. 5 days that a sick child is waiting for the specific treatment they desperately need.
And this graph tells the story perfectly. The red line represents the old method. See that slow, gradual slope as patients eventually get treated? But now look at the blue line. For the group with the new test, it's practically a cliff. It's a steep, rapid drop, showing patients getting the right medicine so much faster.
So how much faster are we talking? The median time plummeted from nearly 120 hours down to just 14.4 hours. From 5 days down to just over half a day. That's an incredible, life-altering reduction in waiting and uncertainty.
But you know, it's not just about speed. Remember that iceberg? Knowing the diagnosis quickly empowered doctors to go look for the hidden dangers. Before the test, only 24% of children got a full workup for that dangerous disseminated disease. With the rapid test, that number skyrocketed to over 80%.
And this had real life-saving consequences. Because doctors knew what to look for, they found 2 kids with bacteria in their blood and 3 more with hidden abscesses in their abdomens. These were life-threatening conditions that might have been completely missed otherwise.
So all of this data is pointing towards a new, faster, and much safer future for diagnosing this disease, especially in the places that need this technology the most.
Because, let's be real, speed is useless without accuracy. And this test delivered. It had a sensitivity of over 90%, which means it correctly caught most cases. And its specificity was 100% in this study. That means if the test came back positive, you could be certain the patient had melioidosis. No false alarms.
The big takeaway here is that the power of a fast, accurate diagnosis is truly transformative. This isn't just about one test or one disease. In hospitals and clinics with limited lab resources, simple tools like this can revolutionize how medicine is practiced and save countless lives.
And that leaves us with a final, powerful thought. This one test changed everything for children with this one disease in one hospital. So just imagine, what would it mean for global health if every clinic in every corner of the world had simple, life-saving tools just like this one?